Well, when a patient goes to see their primary care doctor, they might have an injury or maybe they hurt themselves doing something, and sometimes it's hard to tell if the injury is going to heal on its own or might be more significant. So that doctor will generally refer the patient to us as radiologists, and then we sort of work with the doctor to decide what is the best test to evaluate that. And we can use MRI, CT, ultrasound. I mean, generally we try to find the least expensive and the least radiation to do the examination, but ultimately we work with the referring doctor to answer the clinical question and try to get that patient back to health and activity as quickly as possible. Yeah, well, we do actually. I mean, in the summer and in the warmer weather, people are certainly more active and out and about, and so we do see an uptick there as the spring, as winter ends and the spring comes out, and everybody's excited to be out. And also in the fall, unfortunately, when the kids are back to school, doing their training for their sports and getting back up to speed, we see some injuries, a little uptake in the injuries there. Hopefully most of them are minor and they heal well. But sometimes they're more significant, and they'll need our help to sort of guide them into what therapies to do for those student athletes. I believe that you should sort of wait a couple of days to see if you're feeling better, because most things do heal on their own, or a lot of them do. But if you find that it's still persisting after a few days, you go to your primary care doctor or an orthopedic surgeon and let them evaluate you, and they'll decide if and what type of imaging is necessary, and they'll work with us, and together we can sort of find the best way to get an answer for that patient and get them on the right therapeutic regimen.